recorded. And so if everyone would try to remember to stay muted unless you're talking, I think that will help the recording go better. So, and I think we are recording. So, good evening, everybody. My name is Dr. Joan Doughton. I'm a child and adolescent psychiatrist at Children's Hospital and Medical Center in Omaha, and I'm the membership chair for the Nebraska Regional Council of the American Academy of Child and Adolescent Psychiatry. And we truly want to thank each and every one of you for being here tonight. The Nebraska Advocates for Child Health is a new group established between the Nebraska chapter of the American Academy of Pediatrics and the Nebraska Regional Council of the American Academy of Child and Adolescent Psychiatry. Our individual members and individual groups have been advocates for child health since we became interested in medicine. And pediatricians and child psychiatrists have been working together for many years to educate and advocate about issues affecting the children we treat. In the last year, we actually received a grant from the American Academy of Child and Adolescent Psychiatry to improve our advocacy abilities by further combining our efforts and really just learning more about how to be effective advocates. We're focused on becoming more present in local and statewide advocacy. And we really want to become a group that legislators and other leaders turn to for information. We do have a cover letter and brochures describing some of the topics that are really kind of near and dear to our hearts, and then information about how to contact us. And you guys will all receive that after our discussion today. And we have 5 general areas we feel really impact the patients we see on a daily basis. The first is health insurance. You guys know private insurance does not cover all of Nebraska's children. 25% are covered by Medicaid or CHIP, and then there are 26,000 that are uninsured. Secondly, we really feel each child deserves to receive care in a medical home where their primary care pediatrician and then corresponding pediatric medical subspecialists are also there, including mental health professionals. Third, we really feel that expanding the psychiatric workforce is an important link to improving access to quality mental health care. I think you guys all know Nebraska is considered a severe shortage state for child and adolescent psychiatric care. Fourth, we do feel uniquely positioned to provide expert guidance when it comes to keeping our children safe. We have lots of information about school safety, drowning prevention, firearm safety, car seat safety, childhood obesity, unintentional ingestion, and we could kind of go on and on. And then lastly, child and adolescent psychiatrists, developmental pediatricians, and general pediatricians all know the importance of healthy early childhood development and all of the facets of support and guidance needed for this to occur. So those are sort of overarching ideas that we feel like we can kind of contribute education and certainly advocate for in our state. So thank you for listening to some of our kind of top priorities. We would like to go through and give each of the senators a chance to answer kind of 2 general questions that we have. And we'll give each senator around 8 to 9 minutes to kind of talk through these topics. The first is, what do we need to know from you to be good advocates? The second is, what are any issues or challenges that we all need to be aware of for this upcoming legislative season? And so if you can kind of talk through each of those questions, and then at the very end, we will kind of have time for questions or interactive discussion. So we would like to start first with Senator Arch, who actually graciously gave time back in August to kick off some of our local advocacy training moments that we've had. And Senator Arch was elected to the Nebraska legislature in 2018. He represents District 14. He's worked as a healthcare administrator as the director of Boys Town National Research Hospital from 2011 to 2018, and served on many boards, including Nebraska Hospital Association, Grace Life Bible Church, Creighton University Medical Center, St. Joseph Center for Mental Health, Grace University, Prairie Health Ventures, UnionNet Healthcare Network, and Overland Hills Church. And his current committee assignments include General Affairs, Health and Human Services, Nebraska Economic Development Task Force, Urban Affairs, and the Youth Rehabilitation and Treatment Center Special Oversight Committee. So Senator Arch, thank you for being here, and we'll kind of let you take the floor.
Okay, 8 to 9 minutes. Okay, here we go. Thanks for inviting me. I think it's very important that that you feel strongly about issues. You've got the relationships and the skills to advocate for those issues in the legislature. Some quick points. What do you need to know to be good advocates? I think the first thing you start with, and this, I'm sure this will surprise most of you, but don't assume we know anything, because that's, well, you're probably going to be right. Start with the basics. Help us understand, because I think any industry, and we're guilty of it in the healthcare industry, as I say especially, but any industry has its own jargon, has its own, its own language, its own thoughts. It's the way you say things, and you'll be using terms that are really technical terms, and I don't mean medically technical, but I mean technical to the industry. And that's, there are so many people that come and talk to us there, on so many different topics. So as simple as you can be, as direct as you can be, the better. And as I say, just don't assume we know anything. I guess second point, I would say good thoughts carry the day, not volume. I know some advocates think that maybe 100 letters are better than one, and at about 99, I won't say 100, at about 99, it gets a little irritating. So I would say, focus on good rationale, focus on clear communication, rather than just volume of communication and having everybody write letters from, all the members and all of that. So I think that's more effective. It certainly is with me. Another point I would say is every senator is different and probably wants different modes of communication. Some people live on emails. Some people want a printed letter. Some people want a conversation. You kind of have to get to know the senators, and lobbyists are probably sizing all of us up along those lines as to the best way to communicate, and sometimes communicating through somebody else, rather than directly. It varies. But I guess appreciate the issue that we respond differently to different modes of communication. For me, I know that I mean, truly, I don't know, and the other senators here will, I'm sure, share this opinion, that we get so many emails. It is voluminous, and you can't pay attention. You can't pay equal attention to every email that comes in. That's just the reality of it. And so, direct communication, the phone call, the conversation, it sometimes is far more effective. And I think most senators are open to having those conversations. So, personal relationships, always best. Taking the time to develop that. And again, probably not terribly difficult. It takes, just kind of like developing a friend, it probably takes several contacts, several times, and pretty soon you're starting to put the name with the face, and those relationships then pay off. So that's how I'd answer the first question anyway. Second question, child health issues do you foresee? Well, I mean, I'm really interested in hearing the other senators talk on this because I think it's a personal perspective, you know, our own particular passion or background, our life experiences that would lead us to our issues. For me, I would say teacher education for managing classrooms. That's a big one for me. You know, that's my Boys Town background, obviously, but I just think that my wife's a substitute teacher. She comes home and tells me what she's facing in those classrooms. We're not we're not doing a great job with the behavioral health issues, whether it be identification of those issues or dealing with the more severe issues. And it varies. It varies widely depending upon the school district you're in. Some school districts have resources. They have departments that handle that. They have training. Others have nothing. I mean, they're really struggling. So I would like to see something that comes to help teachers in managing the behavior of the classroom. And that's, I mean, you can call it mental health, you can call it behavioral health, you can call it out of control behavior, you whatever. But it's the ability for the teachers to manage the behavior so they can teach and the kids can learn. And I think that's very important. And then the second topic, which my interim study this session right now is on telemedicine and behavioral health, again with the use of telemedicine. I think it's an opportunity that has opened up as a result of our pandemic we're experiencing, and we want to keep it open. We want to make sure that we don't have regulations that get in the way, and we want to make sure that we understand you know, how to support that. The physicians, the providers, I think, are the ones that determine what is good medicine, what is good care, and if they determine that, they should be allowed to do that. And so we've got a list. We took a survey of a lot of different providers and insurance companies and the state and many different things, and we've got a list. It's not a long list. It's a pretty short list, actually, of things that we want to make sure that we address so we can get out of the way and let the providers and the patients connect via telemedicine. So, and I say especially for behavioral health work, I think that with our insurance survey that we did, it was interesting because Medicaid, you know, you kind of have Medicare, Medicaid, and commercial insurance as the three big buckets. On the commercial insurance side, I mean, of course, both Medicaid and commercial insurance had exponential growth in telemedicine. But on the commercial side, it was about 50% behavioral health. So the use of telemedicine in commercial insurance products were about 50% behavioral health, which shouldn't surprise us, I guess. I think it lends itself perhaps more easily to the use of telemedicine than some of the other specialties that require instrumentation and touching the patient and that type of thing. So that's good, but we want that to continue, and I think it will open up access where perhaps limited number of providers, you know, close by within driving distance, especially in some of the rural areas, they can get that. And so anyway, a lot of issues there, but so those are kind of my responses to the questions, but appreciate the opportunity to talk about it.
Thank you so much. Next, we will have Senator Cavanaugh. Michaela Cavanaugh was elected to Nebraska legislature in 2018 and represents District 6. She's worked at the Buffett Early Childhood Institute at the University of Nebraska as the Director of Development for Opera Omaha and the American Province of the Servants of Mary, and as a staff assistant in Washington, D.C. for U.S. Senator Ben Nelson. She has served on the board of directors of Inclusive Communities. Her current committee assignments include Health and Human Services, Interstate Compact for Adult Offender Supervision, Transportation and Telecommunications, and the Youth Rehabilitation and Treatment Center Special Oversight Committee. Thank you, Senator Cavanaugh.
Thank you so much. And thank you for inviting me to speak with you tonight. I will probably echo some of Senator Arch's comments as far as how to engage with your state legislatures. I think probably the most important thing that Senator Arch said was the personal relationships and how every person kind of takes things differently. That's been a learning experience for me because I'm used to meeting people where they are instead of having them meet me where I am. And so I still receive information like 20 different ways, which is a little overwhelming, but I like to, if people want to talk to me face to face, I try to do that. But that can be very time consuming. And so, it's all different ways and depending on the topic, but lobbyists are, sometimes they are a frustrating part of our governance, and sometimes they are an extraordinarily useful tool. And the relationships that they build with legislatures and understanding how legislature individuals take in information, that is one of those times where they really can be an asset. And so that's it for my plug on lobbyists, but but there you have it. Um, I really appreciate hearing from people and hearing their personal stories, which I think is impactful. But data is really what kind of drives the bus in strong public policy. And so while personal stories can bring color and light to a situation, the actual data is really what we should all be, in my opinion, using to make our decisions. And so when you show up with that sort of overlap, I think that that's when you have the most impactful storytelling, whether it's a meeting with a senator or a testimony in a hearing or a conversation. I think having the data and the story to back up the data is really where you are kind of winning the argument, so to speak. For the other part was challenge. Let me see. I wrote down challenges, correct, in the upcoming session.
Yes, anything you see, kind of issues coming up in the upcoming legislative season or challenges that you think this group maybe could be particularly aware of or kind of involved with?
So there's a couple of things that I think just as a state and really as a country that we're going to be facing when it comes to early childhood. So of course, the fact that we have children not in schools as much, we have seen a significant decrease in calls to social services, which you would want to be excited about, but unfortunately, we know that the reason that is because there aren't eyes on these kiddos that are maybe not having access to food or water or utilities and things like that. And so having that lack of oversight, and you mentioned medical home, but like school as hub is a concept that at least in Omaha we've been working towards for a while. I mean, we have healthcare facilities attached to schools. So school as hub is this really important model that we've been working towards in Nebraska, especially in the Omaha area. And I think we're going to see some really long-term repercussions from that. Additionally, childcare. Our workforce is we always had a struggle with having a large enough workforce to fill the jobs that we have. We have low unemployment or underemployment, people with multiple jobs, but we have low unemployment in Nebraska because we don't have enough people to do the jobs. And now we have people that are forced to off ramp on these jobs because of this situation, because whether they're sick or their kids aren't in school. And so our child care infrastructure has become vastly more important. And child care subsidies are not high enough for a child care facility to operate. So even if we had families say, okay, my kid can't, like my childcare actually allows us, my two oldest are young enough, they're first grade and kindergarten, that if they're not in school, we could send them to our childcare where our son goes, which let me tell you has been an amazing godsend. But for my mental sanity mostly, but it's been amazing that they do that. And so but that's not the reality for most childcare, is that they can't take older kids and things like that. And so, you know, what are we doing, and how are we going to get creative in addressing that? And we have seen some entrepreneurial innovation in that area. I know that there is a woman here in Omaha who started a company. She was starting this before the pandemic, but now she's partnered with, I think, UNMC and Mutual of Omaha, and she's like leasing empty office space on campus at the university to do remote learning for employees at UNMC. So parents can bring their kids that are in OPS, and they can do remote learning, and they can have the ratios that they need, and they're using a conference room. So we're seeing some really great innovation and creativity. And I think that this pandemic is, of course, a tragedy, but also we've, like Senator Arch was talking about with telehealth, we are also on taking advantage of this opportunity to find creative solutions and maybe move them forward to be better in the future in how we work in our lives. So I do think that those are going to be some really big challenges, however, that we do have to find solutions for. And I would say, one of the final things that at least is a concern for me, and it was a concern before the pandemic, but it's even more so now, is, you know, we have this Family First initiative where we're trying to keep kids in the home more, and just having the infrastructure and the oversight to make sure that that's happening well, I think is really important. I have been talking to our Nebraska Supreme Court about diversion court for parents with young children. And I think that that's something that in Nebraska we will be working towards pretty soon, actually, which is exciting, so that we can help, you know, if you have a child under a certain age, under, I think, maybe 3, that we can, and you've committed crimes that are not necessarily needing to go to the penitentiary, that we can find these alternative programs and sort of break up that that intergenerational incarceration cycle that we see, and intergenerational poverty. So yeah.
That is wonderful. This is great to hear from both of you so far. Next, we will hear from Senator Wishart. Senator Wishart was elected to Nebraska legislature in 2016 and represents District 27. She's worked as the Director of Partnerships at Beyond School Bells with the mission to improve access to quality after-school and summer school programming for Nebraska youth, and also worked at the Nebraska legislature for 6 years as a staff member. She was elected to the Lincoln Airport Authority, served as chair of the board, has also served on the board of the Nebraska Foster and Adoptive Parent Association, and as spokesperson for Let's Move Lincoln, an initiative to reduce childhood obesity. Her current committee assignments are appropriations, vice chair of the State Tribal Relations Committee, and the Youth Rehabilitation and Treatment Center Special Oversight Committee. Welcome, Senator Wishart.
Well, thank you so much for having me on tonight. This has been a really good discussion so far, and excited to hear from my colleagues. I'll add a little bit to the list that they've given you for advice for working with senators. Being a former staff member, I have to do a plug for our staff. A lot of times, if you make really strong connections with the staff in an office, that's kind of essential, especially for getting maybe some heavier material, which is a lot of reading. Sometimes staff will read through that and then get the highlights to the senators. So definitely recommend making sure you take time to know the staff in the offices. And sometimes, and actually a lot of times in this legislature, staff stay beyond the senator's term. And they know that district really well, and they know the issues really well. So that would be my first recommendation when you're building relationships. Be kind. It's not always easy, just because a lot of times, especially since you're working on like you care for kids, and an issue might not go the way you want it to, it's easy to get very frustrated, but just recognize that there's a lot of decision making that goes into why a senator votes a certain way, and also you may need them on another vote. And so I always tell people to be kind. You never know when you're going to be working with that senator who may have opposed your issue. Also, sending supportive notes to senators who have done something that has benefited kids. A lot of times we hear when there's a challenge, sometimes it's good to send a, hey, thanks for doing that. This really matters. I always meet with potential opposition to any issue that I'm working on before I draft it, just to see if there's a way to overcome some of the challenges. I don't always get that opposition to support the issue, but sometimes I get them to a neutral position, and that's very helpful. And also, even if they oppose it, sometimes good critique is actually beneficial to the legislation. Think about the long game. Sometimes the issues that you care the most about get defeated a couple years in a row, and then things kind of work out and you get a bill through that third year. For example, a piece of legislation I worked on with a woman who worked on it for 17 years. It was to improve quality of care in assisted living facilities, and she finally, we had a breakthrough, and a lot of the organizations that were opposing it came together, and we finally got it through. So definitely think long game. Determine who the best messenger is. Sometimes I truly believe that progress happens at the speed of trust. And so sometimes when you are trying to convey something, just think about who's the best person to convey that to a senator. Who are they going to have a kind of immediate trusting relationship with, if you can find that person. And then the other thing I'd say too is, the issues that you're working on are ones where I can see senators becoming champions of those issues. So a lot of the times, there's only 49 of us. We know a lot. We know a little about a lot of issues. And we rely very heavily, like, for example, John and Michaela, they're on a Health and Human Services Committee. When they come to me and say, this is an issue that we need to pass, I'm going to really trust they've done a lot of the deep dive work in that. So we work really on high trust a lot of times with senators who are subject matter experts on different issues. So find a few champions, and I'd recommend finding champions who are Democrats and Republican, rural, urban, and maybe get like 4 champions that are just really willing to dedicate and prioritize sort of early childhood, child health care, those kind of things in the legislature, so that they can be subject matter experts. So that was kind of my additional advice on just navigating the legislature. To add for a few other items that I see us working on that pertain to children, I think Michaela touched on this. Childcare is going to be a huge issue. They are small businesses, and most small businesses are struggling to make it to the end of the year. And I'm worried with the uptick in cases that we're going to see some childcares shut down. There's different estimations that are floating around. Some are terrifying. It's like 40% of childcare. That's a huge issue. It is really hard to find childcare. When my husband and I were foster parents for a little baby, it was impossible for me to find childcare in Lincoln. And so that's something we need to work on. I've heard vaccinations for kids and just overall checkups are down. So I think we're going to be playing catch up next year in supporting not only educational supports for kids who have missed out just on time with teachers, but also on some of their basic healthcare needs. That's something that I think we're going to need to work on. I sat in on a series of meetings around the fact that Nebraska has the highest rates for pediatric brain cancer than any other state in the country. That's very concerning. UNMC is doing some deep dive research into this. Potentially it follows our watershed, and we're seeing the hot spots in rural parts of the state, that's a kind of a long-term, and former Senator John Harms, who was the senator for Scotts Bluff area, which is now filled by Senator Sinner, this was an issue he cared deeply about as well. And so that's something I think as a legislature we're going to have to figure out, because families aren't going to move to a community if they're worried their kid is going to have brain cancer because of the environment that they're surrounded by. So they're still working on where that's coming from, but it's concerning, and that's not a statistic that we want to be the best at. To kind of touch a little bit on what Senator Arch talked about, I think we are going to be working on teacher education, managing classrooms. That's an issue that was hotly debated this year. I don't foresee it going away. It's something the teachers care deeply about. My husband and I are actually relicensing to be foster adoptive parents, and have been going through a lot of trauma-informed learning lessons through Cedars. And it's really amazing to see just how trauma at a young age can really impact kids' behavior long into the future when they become even adults. And so what we can do in classrooms to support teachers being able to help with that. Telemedicine, Senator Arch talked about that. I will be bringing legislation to increase funding for special education. I brought it 2 years ago. We sorely underfund special education in the state. We leave it up to local communities, which results in higher property taxes and less wraparound services for kids with special needs. So that's something I'll be bringing again. The one other thing I wanted to add to what Senator Cavanaugh said, which is very concerning, is, she said that hotline calls are down for child abuse. Well, the really concerning part of that too is that hotline calls for domestic adult assault are up. And so what we're finding is there's just a likelihood that teachers are kind of the front line people who notice and reach out when they see a kid is neglected or abused, and they're just not interacting with as many kids. And so those kids aren't getting the adult response that they need. So I think that's something we're going to be needing to work on next year as well.
Thank you all. I took a bunch of notes through all of that, as I'm sure a lot of people did. So I want to open it up just for questions and comments and a little bit more of an interactive discussion for a little while. For sure, no matter what, we'll end by 8. And if we end a little earlier, that's okay too. So anyone have any thoughts or questions?
This is Rachel McCann. I'm a pediatrician with Children's in Papillion, and I will just bring up probably one of the most hotly discussed topics of the moment, but I just wanted to put in a personal plug for a mask mandate. I am on day 10 of my own COVID quarantine at home. So my daughter and I both have COVID, and we're doing well, but it's obviously we've been preaching that for a while, and it is concerning to all of us healthcare workers regarding resources and ability to take care of patients. And then it does hit closer to home when you yourself are sick and hoping that if you need to go to the hospital, someone will take care of you there. But luckily we didn't need that. So I don't know what, from your standpoint, we've actually my husband and I have contacted our senator and the governor and sent emails just reinforcing how strongly we feel about a statewide mask mandate, but obviously we'd appreciate any support from other senators as well.
We hope you feel better soon, Rachel. These are difficult times, and we have seen progress, at least with North Dakota and Iowa, in terms of a mask mandate, and a few more cities. I think Beatrice has enacted it, and maybe Kearney, Grand Island, others are considering at Ralston and Bellevue, but these are very difficult times, and I think especially so for children. Senator Wishart mentioning their education, same as Senator Arch. To follow up with what Senator Cavanaugh said, one of my twin nephews is the frontline worker. He's the investigative worker for the Norfolk region for protective services. And it's very difficult when schools are not in session, they're not identifying. And then if we have the accompanying increase in domestic violence, children are witnessing that, they're traumatized by it. So we actually would have a higher incidence of child neglect and potentially child abuse as domestic violence increases. And that's of concern. I'm a child psychiatrist in Lincoln. I'm of an age, I don't see a lot of patients, but I do consult to a group home, and it's for adolescent male sex offenders. And with some frequency, we will have transfers from the regional youth treatment centers, either at Kearney, and we've had one come directly from Lincoln. And since we have senators on the call with expertise about the oversight committee, I was quite taken back to learn. I thought that there had successfully been a stay on transferring from Hastings to Whitehall, the substance use program. And it appears that that wasn't the case. And so the last I knew, we had both boys and girls at Kearney. We had some plans for girls to be at Hastings. We had boys and girls of severe intensity at Lincoln. And at Whitehall, I believe we have a sexual offenders program for developmentally disabled children and youth. And then we have the youth substance use treatment program. And I'm wondering what we know about the current status and what DHHS is planning, and if they have to give notice to the legislators before they make further changes.
Well, maybe I can take some of those questions since I chair the oversight committee. We went out, we toured Kearney last year, but we toured Hastings, and we toured the Lincoln facility, the YRTC facility in the detention center there, and then Whitehall. So your first comment regarding the stay on the movement. When the legislation was drafted and passed, I think that there was an understanding and an intent that it would cover it, but it was written in such a way that it was YRTC directed, and the substance abuse treatment, the male substance abuse treatment in Hastings is not part of the YRTC program. It's separate, and it is a PRTF. And so it was outside of that piece of legislation. A lot of strong feelings were expressed to the department regarding that transfer, but it did occur. And so you're correct. The two facilities that are at Whitehall are under the direction of the Lincoln Regional Center, the hospital there, not the YRTC. So we are in the process right now of developing our recommendations on the oversight committee, and we will have a report to the legislature by the end of December on the YRTC programs and what our recommendations will be. They have an obligation as a result of bill we passed last year to provide us with an operational report, an operational plan by the end of March. And so there can be no movement to the Hastings facility that has been vacated with the moving out of the substance abuse program. You can't move the girls there. And they will be developing and presenting to us with their plan by the end of March. I think that the overall perspective of the oversight committee is we are certainly in a better place than we were last year. when the YRTC had some very, very serious issues. There's been some good movement. We're heading in the right direction. We're not there. I'm sure we'll have more recommendations that'll come out as a result of our oversight committee and the report that is generated from that committee. Yeah, I could go on and on about the YRTC, but I'll leave it at that. But that's where we are right now.
Thank you, Senator Arch.
I actually have a follow-up question for you, Beth Ann. And I am gonna I'm gonna move to informal mode now because some people have MD after their names and some don't. And I don't want to accidentally start calling people doctor and not doctor. So Beth Ann, if you're a doctor, I'm just calling you Beth Ann. You had mentioned that you had youth that were discharged from Whitehall to the group home that you work with. Could you maybe tell us a little bit more about that? Because when we toured, oh, John, I don't know, what was that, October? It's all a blur now, right? The days all run together. I think we toured in October, before we had our hearing in October, the Whitehall facility, and we understood that they had reduced the population and had a waiting list. And we weren't necessarily, and maybe I'm misrepresenting, and John can jump in here if I am, or misremembering, but I don't remember being told that they were being discharged to the group home that you work with, but maybe I'm wrong, John.
I don't have any oversight or control over who's admitted. This is a 12-bed group home in Lincoln operated by Hope Spoke, which was the Lincoln Child Guidance Center. And there has been movement of more than one youth I've seen, Whitehall to Hope Spoke, or even vice versa. But they have different categories. Hope Spokes is a therapeutic group home. It's not a PRTF. And so it gets a little complicated where they've come from. But we have had from Kearney, when the, I guess you'd say the probation or whatever is over, or a judge orders, we have had youth directly from Kearney, and we've also had them from the Lincoln branch of the YRTC.
Okay, no, but not from Whitehall.
We have had one from Whitehall. We have one now.
Do you know, have they completed their program at Whitehall? Because
they've usually, I believe they've, the two I can think clearly about, Michaela, are they were treatment failures or administrative discharges. One of them, a year's stay in between in an out-of-state facility that was a PTRF. And then we have him now. And we had another one with a similar circumstance that I felt we weren't able to treat. And after 3 weeks, he was so disturbed that he needed a higher level of care. This is a problem in Nebraska. I found after 40 years in Michigan, because our age of majority is 19. And so our 18-year-olds age out even if they are sent to out-of-state facilities. So this is another thing we need to keep on the back burner and always be mindful of our, if you will, 18 to 22, 25-year-olds. Do they have they already, if they were in foster care or some other state supervision, do they have the wherewithal, the means, the supervision, the agency support to succeed beyond young adulthood? And some of our group home discharges go to Cedars, and Cedars supervises their living arrangements. And I'll get off this topic, but this is a forgotten, often neglected age group that need to enter the workforce. Oftentimes they are teenage parents involved with substance use and don't have adequate health care. And so I do think the idea of pediatric medical homes could go a long ways, whether it's through Medicaid, through CHIP, through even commercial insurance should be examining this much more carefully. We need continuity of care.
Yeah, thank you. That helps. That clarified. It was a little red flag for a second, but that makes a lot more sense what you just said. So thank you.
And if I can dovetail on to what Beth Ann said, this is Tina Scott. I'm a pediatrician in Plattsmouth, and I've worked with Beth Ann before, and I know the AAP has a plan to work better with how we transition youth from our practices into appropriate practices for young adults. So it's a problem for all young adults really, but in particular, those that don't have the support once they leave whatever institution, foster care, foster home, whatever they're coming from. And that's where, and Beth Ann knows I feel very strongly about a medical home for all kids, because what we can do is help them find that next place to go. We can look at their situations, we can look at even their geography and help them find an appropriate next medical home. So the medical home piece is pretty important in all age groups, but not any less important in that age group for sure.
Do you work at all, Tina and Beth, do you work at all with the, oh, it's called the bridge, oh, gosh, I'm just like, Bridge to Independence?
Bridge to Independence.
Yeah.
I was a consultant. I'm a child psychiatrist, and I'm still doing some consulting to DHHS, but more administrative reviews. And yes, they've tried to bolster those programs, and I don't know what the outcome measuring the success is, or frankly, it was never clear to me what the admission criteria were. It did not seem that every person who was still in foster care, if you will, necessarily had a clear route to go on and be sponsored by Bridges to Independence. And so I'm not an expert in that area, but medical homes, even though we think of them as medical, we want to remember that psychiatry is a branch of medicine, and medical homes do address in part mental health issues, and our medical homes have the ability to have case management and relative expertise about ongoing mental health services, because we know that bipolar disorder and schizophrenia, not to mention anxiety and depressive disorders, they have their first onset in usually mid to later adolescence. These are not disorders that begin in adulthood. And when you add substance use disorders beginning in the middle school ages, this is a whole panoply of things about which citizens in general and our government, I think, needs to be attentive to.
Well, I would be very interested in following up with you, Beth, on just that continuity of care and support in the medical home idea as well. So I'll connect with you, and yeah, I would like to have a longer discussion on that.
Thank you, Senator Wishart. You had sent me your card with a note recently, and I will follow up probably after Thanksgiving.
Any other questions or comments from anyone?
I have a question. I'm Carla Lester. Good to see you, Senator Wishart. Fun to connect with you again. But I have a question about Medicaid expansion. Like, are there any data points being followed, like for child health as far as access, or for special populations like Dr. Brooks is talking about?
Not that I'm aware of yet. And of course, child health wouldn't be in the Medicaid expansion group itself. I think that right now they're concentrating on getting them enrolled. The last number I saw was about 14,000, but I think we're going to have at the end of the year probably another large group that would move over from the insurance exchange. It's estimated at maybe 17,000. So that could happen shortly here at the end of the year. But from the reports I've seen and what I've heard is that the expansion enrollment is being handled well, and so we'll be able to fold this new population into our program.
Great, thank you.
Yeah, I would echo. I haven't heard any complaints, and normally I do.
Yeah,
So,
right.
so no
So
complaints to me is like, okay, good.
I've got a question. Earlier, it was mentioned about vaccines, and that is a concern. The catching up of vaccines, maybe for those families that have missed their well child appointments, and how we can ensure that we get our families in and we get them caught up. I think particularly for infants, right? I mean, that the timing of the infant vaccines is probably the most important timing. And some of the older vaccines have maybe bigger windows that you can deliver the vaccine. But what are you seeing in your practices, and how can we, when they come back, make sure that we catch up with those vaccines? I'm sure that's important to all of you.
Well, this is Tina Scott again, and I hate to sound like a broken record, but this is where a medical home for smaller kids is super effective. As much as I struggle with the electronic health record every day because I'm old and not technologically savvy, we can pull up reports. We can see who's behind. We can reach out to them. We can send letters. When they're in our office, we can see immediately how far behind they are and work on catching up right away. And that becomes more difficult when you have kids that have not had a consistent medical home or have had immunizations in several different locations, or inconsistently immunized, as some of the kids in out-of-home care are. I guess I hate to preach the same thing over and over again, but a medical home is just, it's incredibly important to care for children throughout their lives.
This is Angie Cradaville in Kearney. I'm a pediatrician here in Kearney, and Tina took the words out of my mouth. That's exactly what I was going to say. I can tell you exactly which one of my patients is behind, and my nurses are calling, and we're working on that. The population I'm afraid we're missing is the population that isn't getting into our offices. And that's the group that we as pediatricians have a really hard time catching, where we could use the state's help to try to, find those kids and bring them in. Daycare schools, I mean, I wish there are other places that they are. And another area where I've seen numbers decline is we have more kids being homeschooled this year than ever before with COVID. And I know in Kearney Public Schools, our numbers are down several hundred kids that are being homeschooled this year. Nobody's watching those kids because the school isn't checking vaccine records. Nobody's looking at those if they're doing it at home. And so that's another group that I think we're missing, where if we could combine with the school and some of our other resources where those kids might be, because I think we are missing them because they don't get to us.
I'm Matt Gibson. I'm one of the a general pediatrician here in Omaha. I'm obviously here in Omaha. That's where I live. District 20, what up? But I think kind of echoing off of you guys from what has been said so far, I think that even today, I had 3 different patients who I hadn't seen in anywhere from 4 to 9 months when they were supposed to be seen at 2-month intervals. And it was playing catch up from an immunization side of things. But as Angie was saying, that's possible because I know them and because we can call them and get them in. I think on a slightly positive note, the Nebraska Immunization Registry has been huge when we have had a lot of inconsistent care, to be able to pull that data and see like, okay, even though you've been seen from 4 different providers over the past year and a half, we can find some of that information. And I am showing my ignorance here, but I just didn't know from a public health side of things, if there's any way to run reports from the state registry. That would be obviously one. I have no idea how that works. If it's something that could be done, because then you could look and see, okay, who's missing, who last reported their immunizations. If there's a way to like send out a notice to everyone who's connected to the registry, that would be a way to kind of maybe catch those kids who are already falling through the cracks. But again, I'm just on vaccines for Methodist Health System, and trying to manage our health system standardization protocols has been a 3-year like Herculean effort. So I have no idea how the state would do that with their registry, but that was an idea.
Don, I'm going to take a moment to plug one of my favorite entities, Knee-High.
I thought of the same. I just wrote it down. Seriously.
I
don't
love
know.
Knee-High.
There
They
could-
testified for us on Valentine's Day, and I literally wrote the woman during the
Yeah.
testimony of Valentine, and I was like,
Right.
I love Knee-High. It's
Yeah.
So the Nebraska Information Exchange, is amazing. And I've even in my own doctor's office, they were like, when was the last time you had your annual exam? And I was like, I don't know, I've had 3 kids, does that count? And they're like, no, it doesn't. and the doctor said, I'll look up in Knee-High. And I was like, I know what that is. It's amazing. So Knee-High is our information data hub. But that would be a question for the infamous Jamie Bland at Knee-High as to whether or not that's something that they can do. But it's certainly, the opportunity does exist. And I just want to highlight from a personal level, like I am a parent of 3 children under the age of 6. And probably several of you on here know my pediatrician, Dr. Erin Laux, who is amazing and very patient with me. And if it weren't for her office at Children's Physicians and the Westside School District, my children might not be vaccinated, because they together remind me constantly. And my kids couldn't have shown up at school in August without turning in their vaccinations. So that's how I made sure that we had lapsed on them, because school shut down, kids had birthdays in the summertime, and then it was August, and it was like, oh, we've got it. So we showed up, and my kids hated me, and I bought them all ice cream, but they got like 20 shots, not each, but between them. And that is hard. And, and I'm on the Health and Human Services Committee, and I'm very pro vaccinations, but it's hard. It's hard. And so figuring out how to make it less of an obstacle is certainly something we should be trying to solve for. And that, again, home health. And we've gone to we call her Dr. Erin. We've gone to Dr. Erin since I was pregnant with my oldest. So we've had our home, our medical home. And then Children's Hospital is our medical home as well. And unfortunately, we are frequent flyers. I didn't realize that people aren't frequent flyers. I know all about the videos that are available, but my daughter has asthma, and also there was an incident with a bat. So we've had she's known in the ER very well. But but they have all of our records all of the time. And that is an amazing gift of technology and having that medical home. So I really appreciate that so much. And also I just love Dr. Laux. So if any of you see her, just be like, you've got a fan.
I was going to echo kind of what you said about Knee-High, and very timely. I was just on a meeting earlier today where they were talking about the expansion of Knee-High. It does have the capability of doing a lot more than just keeping track of vaccines. And I know that they're piloting that in one of the clinics in Lincoln. And so I think that is coming. And I think it will be really exciting to see what we can do with that data when we have easier access to it. In terms of recalling patients. Because yes, I think the big health systems in the state have great ways of doing that. Methodist has one, Children's has one. We can find our patients pretty easily and get them caught up. And we've seen that even this year. Huge drop off in April, May, June, starting in about August when we started getting all those patients back in. We're looking pretty good. And honestly, Children's physicians, so the 13 clinics owned by Children's, did more flu shots in October of 2020 than we did in 2019. So we really are able to get to those patients pretty easily. It is the ones that don't have a medical home or those smaller family practice docs and things that don't have the ability to do this easy recall and send our patients an email, once a month reminding them that they're still overdue for stuff. So I think working through NEHI and trying to make that information go both ways between the state and the individual doctors is important.
I know that Joan will want to be closing this out, but I would say that one bright spot out of a terribly dark era of COVID is that I do believe residents, even outstate, more rural areas, are somewhat more aware of and maybe even supportive of their local health departments. And the health departments have made plugs about flu shots, etc. And so I'm hoping that despite some naysayers, that the tragedy of COVID will impress on others the importance of all types of health resources, be they more medical, more psychiatric, whatever. And that I also think that our public in general at the end of this will be better informed and hopefully know how to access resources in a more diligent, informed fashion.
Thank you, everyone, for everybody's thoughts and comments. I think this was a great discussion to have between all of us, and I hope that relationships continue to build from here, and we can have kind of ongoing conversations. So, Senators, thank you so much for being here and sharing so much of your time with us. We will be sending you a notebook with contact information and kind of our brochure, just so you have that on your radar. And I wish everyone good holidays and a good rest of the evening.
Bye.
Bye.
Thanks so much.
Thank you.
Thank you very much.